Bismillahirrahmanirrahim. Assalamu alaikum. I am Rafia, Doctor of Physical Therapist, lecturer at National Institute of Physical Therapy and Rehabilitation Sciences. Today, the topic we talk about is to explain the common example of liver at work or at home, your diagram, and also explain the anatomical example of liver with diagram and also explain the importance of liver in physiotherapy. So let's get started. I summarized classes of liver in a flowchart form which is easy to memorize you. Example of liver at work or at home. I am only explaining the common example which are used in our daily routine. Rest of the example mentioned in the chart which I have showed you earlier. First class liver. In first class liver, fulcrum is between the effort and the load. And the effort is applied on one side of the fulcrum and the load resistance on the other side. Let's take an example of scissor. The cutting end of the scissor is the location of the load, which could be paper you are cutting. The fulcrum is the point where the scissor blades are joined together. The force or effort in the end or handle of scissor. In second class lever, resistance or load between the effort and the fulcrum. The effort is applied on one side of resistance and fulcrum is located on the other side. Let's take an example of door. Fulcrum hinges are at one end. Resistance, that is load, the weight of the door itself is in the middle. And the effort, the work done on the door your hand pushes, is at the other end. Third class lever. In third class lever, the effort between the fulcrum and resistance. The resistance or load is on one side of the effort and the fulcrum is located on the other side. Let's take an example of a broom. Sweeping action of broom is a class 3 lever. You pivot the handle of the broom near the top, that is fulcrum, and push the handle near the middle effort so that the bristles at the other end load will quickly sweep across the floor. Now discuss anatomical example of lever. First class lever. Let's take an example of nodding movement of head. This pivot fulcrum exists in the place where your skull meets the top of your spine, that is atlanto-occipital joint between the first vertebrae atlas and occiput. Your skull is the lever arm, and the neck muscles at the back of the skull provide the force effort to lift your head up against the weight of the head load. When the neck muscle relaxes, your head nods forward. Second class lever. Let's take an example when someone stands on tiptoes, that is plantar flexion of ankle joint. The axis is formed by metatarsophalangeal joint. The resistance is the weight of the body and the force is applied to the calcaneus bone heel by the gastrocnemius and the soleus muscle, that is calf muscle, to the Achilles tendon. Third class lever. Let's take an example of flexion of elbow joint. Using elbow joint as the axis fulcrum, the bicep brachii apply force, effort at its insertion on the radial tuberosity, work together to move load held with the hand with the forearm acting as a beam. Another example of third class lever is knee flexion. In knee flexion posture, as you can see here, when knee making this movement in when knee making the movement in this direction, suppose with the 10-pound resistance, this hamstring muscle applying that force effort and is pivoting on knee joint. Importance of liver in physiotherapy. Liver are those that easy your work. Through liver, the force applied by the patient is decreased and also decreases the force applied by a physiotherapist on patient. Take an example, suppose physiotherapists want to perform hip flexion, but the problem is patient needs an extension position, so it is difficult to perform hip flexion because all the weight of the patient body is on physiotherapist. More load on physiotherapist muscles and body, and it is also difficult to patient as well. So if physiotherapists firstly perform knee flexion of patient, then perform hip flexion, as a result, load over the physiotherapist muscle is decreased and the effort applied by physiotherapist is also decreases. So this is the advantage to physiotherapists when physiotherapists know how the liver act on body, then physiotherapists easily understand that how amount of force is decreases on physiotherapist muscles and also know that how effort apply on patient muscles. I hope you like my today's topic and understand easily. Thank you.